Hi everyone, my name is Cara Mackler and I'm the manager of campus education and outreach and human trafficking specialist at the Women's Center of Greater Danbury. I am joined today by Sergeant David Cooney from the Danbury Police Department, Attorney Patrice Hamilton from Connecticut Legal Services, and our very own Lynn Nichols from the Women's Center of Greater Danbury. I'm going to give each of our speakers a couple of minutes to introduce themselves and their services after I go over some quick housekeeping things. So first, our discussion today is being recorded, so you may revisit it at any time if you'd like. Second, all of our speakers are going to be sharing their contact information at the very end of the discussion, so feel free to direct any questions to them afterwards. Lastly, our agenda for this discussion is as follows. Our speakers will introduce themselves and their services. Then I will be asking the speakers questions related to resources for domestic and sexual violence victims during the pandemic. All right, so let's get started. Our speakers will now each get a couple of minutes to introduce themselves and their services. So Lynn, why don't you get us started with that?
Thank you, Cara. So as Cara mentioned, my name is Lynn Nichols. I'm the Director of Victim Services at the Women's Center of Greater Danbury. For those of you who are not familiar with the Women's Center, we are a domestic violence and sexual assault crisis agency, and we serve everyone. Some of the services we provide include individual counseling, support groups, crisis response. We shelter individuals who are fleeing from abuse. We provide legal advocacy, and we also provide prevention education and professional trainings throughout the community. We have multiple locations. Our main headquarters is located on 2 West Street in Danbury, Connecticut. And then we have our 3 satellite offices. One is at Western Connecticut State University, another is at Danbury Superior Court, and then we have our residential facility for individuals fleeing from abuse. So,
thank you.
I'm Patrice Hamilton with Connecticut Legal Services. I'm in the family unit of Connecticut Legal Services, and Legal Services is dedicated to advancing justice for people who are low income. We offer help in my area, which is family law, but we also offer help in benefits, immigration, housing, including evictions, elder law, and many other areas. We have 6 offices across the state, and even in these challenging times, we're still working for low-income people, and we're open. We're all working at home, but we're open and available to help.
Great, thank you.
And I'm Sergeant David Cooney of the Danbury Police Department. I've been with our police department for 19 years, first 14 in our patrol division, and the last 5 as the sergeant in charge of our crime scene and property division. But in addition to that, from 2013 to now, I have been our department's domestic violence liaison. What that means is I am tasked with being the point of contact for the Women's Center and victim advocates and court advocates at our police department to assist in any domestic violence cases that they may need assistance with. I also am in charge with recertifying police officers and instructing them in domestic violence and all the changes that happen in domestic violence laws every year.
Wonderful. Thank you all for those introductions. And we'll just jump right into our questions. So starting us off, how are victims of domestic and sexual violence able to access your services currently? So Sergeant Cooney, do you want to start us off with that one?
Sure. It's obvious we're still answering calls. Our department is fully staffed. We have our detectives in, our patrol divisions all in. We will go to any call that we're called upon. When we do arrive, some of the differences you might see is that they'll be wearing the face masks in accordance with Governor Lamont's mandates. And we're going to try to maintain social distances while we're talking with people. So we'll step back a little bit. Maybe we won't go in your house if you don't need to, and just talk to you through a screen door or something like that.
Great.
The Women's Center is providing services as well. We're still open. We're still supporting those in the community. Some of the various ways we're providing those services is through individual counseling rather than doing it in person. A lot of what we're doing is virtual, either by phone or by video. We're also doing the same thing with our support groups. Most of them are virtual, and what we're seeing is we're actually having an increase in attendees or our virtual support groups. And we're feeling as though it's because people in the community are feeling isolated. Maybe attending virtually is more accessible, and maybe people need that support during a time like this. We're also providing crisis response. And so when we provide crisis response, most of that is in person. So for example, if a person is fleeing from abuse, we will shelter them, we will transport them, and assist them in person. And again, using the same protocols, wearing masks, and maintaining physical distancing. We also have our court office, which is located at Danbury Superior Court. And what happened with the court systems in the state of Connecticut is most of them closed and consolidated into 6 different courts. And so our family violence victim advocates who are normally housed at the court are providing the same services, but remotely. So if someone's looking to file a restraining order or looking to discuss their court cases, we are still answering the phone. We are still getting people information, but it just looks a little different. Our prevention education and training is being done remotely. For those of you who need training or any type of professional trainings, we are providing that throughout the community.
Great, thanks.
So we are somewhat limited and hampered, unfortunately, by the fact that of our 38 courts, only 6, as we sit here today, are opened.
Wow.
However, with each passing day, the court is looking for ways to reopen, and we're hopeful that in the coming weeks, not months, we'll be back to doing the business that we need to do. However, during these particularly difficult times, I think it's really important for people to know that legal services is still here and available to help, particularly with temporary restraining orders. And that can start with a situation that's happened in the home and that there needs to be a restraining order filed. I encourage people to reach out to the Women's Center to start the ball rolling on that. They can refer the matter to us. We can assist with things like preparation of the affidavit, information about how to have it served, all kinds of information about the restraining order. Of the few things that the court is still doing, and for folks in the Danbury area, that's the Waterbury Court at the moment. Restraining orders are priority 1, so they're still being handled in the courts. So you can first apply for a restraining order. You can ask the court to order it, what's called ex parte or on the papers, and then there's going to be a hearing shortly after to extend it for up to a year. So restraining orders are still a way to get some relief from a situation that is terrible. And I encourage people to reach out to the Women's Center and look at that option if that's the situation that they're in, particularly with so many people at home, unfortunately at home with abusive partners.
Yeah, I think restraining orders are such a huge topic right now because obviously safety is a huge concern. So that's something that a lot of people may have questions about. So thank you for bringing that up. Is there anything else you'd like to expand on regarding restraining orders right now?
Well, where restraining orders are concerned, I also wanted to add that not only could we seek things like having the abusive person removed from the home and having firearms taken and things like that, we can also seek orders of maintenance, like to keep the lights on and rent being paid or the mortgage being paid or use of a car. So there's other kinds of things that we can look for to ask the court for that can make a difficult situation just a little bit easier.
Great, thank you.
And I just wanted to point out that our advocates are currently assisting, and they have been assisting with restraining orders. If an individual calls us, we go through the pros and cons, we help them navigate the system. And if it seems as though their legal issues are a little bit more complex, we do often reach out to Connecticut Legal Services just to have a more in-depth conversation and sometimes, hand it over to them for more comprehensive legal advocacy.
Yeah, I think it's so helpful that that's a conversation that's happening because some people really don't understand what a restraining order actually entails. And that kind of leads us to our next question. I know a lot of people get confused about the difference between a restraining order and a protective order. I know I still get confused about it. So maybe Sergeant Cooney, can you explain what a protective order is specifically, if it's the same as a restraining order?
Sure, of course. The restraining order, as Attorney Hamilton said, is all a civil matter, so it's handled in civil court, where a protective order is handled in criminal court, so that's our realm. What happens in a domestic violence arrest, a person will get arrested, say today. Tomorrow they have to appear in court. When they appear in court, the judge right away in every single case is going to award a protective order against that person protecting the victim. Now there's the first two lines that's applied to every single protective order in the state of Connecticut. Number one, they have to release all their firearms and ammunition over to their local police department within 24 hours. And number two, they can't stalk, abuse, threaten, or harass the victim. Now the court can go ahead and apply more stipulations upon that. Maybe it's a stay away order, maybe it's a no contact order. But someone has to advocate for that in the courtroom, and someone has to go in front of the judge to say, this is the reason why the subject should have no contact with the victim. That's where the court advocates come in handy. If the victim gets in contact with the victim advocates in court, then they'll go before the judge and say, yes, we need a no contact order because. Or they may say, we do not want a no contact order because maybe the victim does want him around because he provides childcare at certain times. Now, these protective orders are going to be in effect from the start of the court case to the very end of the court case. So when the judge bangs the gavel, when it's all over and done with, that protective order has expired. Now, if he's convicted of a major penalty or a crime, then the judge can order a long-standing protective order. But if not, then that protective order is over and done with. So the victims need to be able to follow that court case from beginning to end, because the protective order may have expired yesterday. They don't know about it. So follow that court case.
Great, thank you for clarifying that.
And to Sergeant Cooney's point, you know, there are arrests still being made. Victims are being provided the same services. However, it looks different. So we are making contact with the victim the morning of the court dates in order to find out what type of protective order should be in place, what some of their challenges are, some resources they may need, and helping them navigate through the system that can be really difficult to understand for someone who's not used to going through the criminal justice system. So just slowing things down for them a little bit. And not only domestic violence cases get protective orders, but also sexual assault cases. When we're working with victims, they also could get protective orders, and there are advocates at court that assist victims of sexual assault with their cases as well. So I just wanted to point that out.
Great, yeah, thank you for adding that. You know, I think this just goes to show that these issues are complex no matter what, but obviously coronavirus has impacted everyone's lives tremendously, and particularly in our line of work, we see the impact that it's had on victims of domestic and sexual violence. So what are the biggest challenges that you're all seeing in your respective offices for victims of domestic and sexual violence during this time? Lynn, do you want to start that one off?
Sure. Well, I think when working with domestic violence and sexual assault victims, they face challenges all the time. And so having the impact of the coronavirus is only adding to those challenges. And there are so many. But if I want to just pick out a few, I would say one of the biggest challenges is access, and not being able to access everything like they would have prior to the coronavirus. So for example, we were just talking about the courts being closed. You know, people are dealing with different issues, and maybe they need child support or new custody orders, or visitations being withheld. And it's a really tough conversation to have with the clients we're working with about not being able to have an avenue to resolve these issues. And so that's been a challenge that we've been facing, but we're doing our best to work around it and plan around it and assist victims however we can throughout the community. But yeah, that's been one of the major challenges. Another challenge I would think of is lack of resources for children who would normally be in social settings. When they're in social settings, they thrive. and the resources that are available to them on a day-to-day basis aren't as available as they used to be. And so that's something that comes to mind. Another challenge would be just fear of getting the coronavirus. We've had clients who were physically abused or sexually abused, and they need medical attention, and they don't want to go to the hospital in fear of getting coronavirus, especially for clients who are at risk or high risk. You know, they'll tell us, I'd rather not go to the hospital because I don't want to get coronavirus. And so I rather do this, and I think this is safer for me. And so these are discussions that we have with our clients, and we just, you know, try to give them as many options so that they can make the decision that's best for them.
Yeah, definitely. Thank you.
So this is just such an enormous issue. The thing I hear most from clients is their sense of isolation, cut off from family and friends that were their support system, perhaps, who they had contact with, you know, on a frequent basis, and now they're limited. Maybe they're limited because they're living in a household now, you know, self-quarantining with the abusive partner. They don't even have a place to have a private conversation. They have kids around, they're doing homeschooling, right? So they don't even have the kids off to school where they have perhaps a few minutes they could call a friend and talk about something that's going on. This isolation is only exacerbating these problems for our clients. In addition to those clients, as Lynn said, a particular concern is children. You know, the people in their lives that might have noticed something isn't quite right with that child, something seems off. The teachers, the coaches, the guidance counselors, the cafeteria ladies, you know, the nurses who see a kid in school and say, kid doesn't seem quite like himself or herself. Those people aren't in their lives right now because they can't go to, you know, team sports, and they're not going to school every day, and they're not going to Cub Scouts and things like that. And that's really worrying because it's those people, particularly mandated reporters, who are trained and have a heightened awareness about issues of abuse, whether that's physical abuse or mental abuse or even sexual abuse of children. Those people are not in those kids' orbit right now. And that's a real concern, you know, for us, that those children don't have anyone to go to. They may have, you know, one of their parents may be abusive, the other one may be in an abusive situation, not sure what to do. So that's another population that I have a lot of concern about. And then the elderly. The elderly, by virtue of their tendency to live alone, can be subject to all kinds of abuse. And if they're not out in the community going to see their doctors or even the grocery store people or their neighbors or things, because they're hunkered down, worried about this virus, then the opportunity to relay to, you know, well-meaning other people that they're in a bad situation doesn't exist. These avenues of communication don't exist. Plus, in general, not entirely, but in general, elderly tend to be less addicted to online life, as the rest of us have come to be, and certainly as young people can be. They may not have access to a computer. They may not use an iPhone. They may not. Those may not be means that they're accustomed to relating to people. They're more, you know, they have different kinds of social communication that's more comfortable for them. They're not going to go online maybe and get information about things. So I'm concerned too about the elderly population, on top of just, you know, all the other people who this situation has just been like a pressure cooker, right? You've got financial difficulties because of unemployment or underemployment. You've got abuse issues that were present before that are exacerbated. There can be substance abuse issues that are only getting worse when people have a lot of time on their hands, sadly.
Yeah.
And all those things are like out there, and we hear it. You know, we're taking calls, we're talking to clients, and we're trying to help them through this. But the thing, I guess, the biggest thing I would say about this is that the isolation is the hardest part.
Yeah.
Because if you have someone that you can talk to about it, be your advocate at the Women's Center, your attorney, a friend of yours, a parent, a sister, a brother, whatever, then it does decrease your isolation and helps you brainstorm about how to fix your situation. But if you don't even have the ability to have a private conversation, How do you do that?
Yeah, definitely.
It's created a lot of problems, and there's a lot of, I think, pent up need that we're gonna hear all about once things open up again. I'm pretty sure.
Yeah, definitely. Thank you for sharing that.
From a law enforcement standpoint, one of our biggest challenges is getting people to make sure that they're comfortable in making the call and basically inviting a police officer to their home. A lot of people are afraid that if they invite the police officer over, the police officer might be infected and he'll be bringing or she'll be bringing that virus into their home. But the victim has to realize that by living in an abusive relationship, cooped up in a house or an apartment, that's much more hazardous than having a law enforcement officer come and help you get out of that abusive relationship. Our officers are very well trained, they're distanced, and they're wearing masks. They put on gloves if they have to touch something. You're safe from that. You should feel free to call us and we will come and we will help. The other problem too is if you put things off and you don't report things, with more time goes by, you have less evidence that the abuse occurred. If it had been physical abuse, you have a bruise. A few days from now, you're not going to have the bruise anymore unless you continue to get abused, which hopefully isn't the case, but it's going to be because these relationships don't just miraculously cure themselves. So you need to reach out, you need to get those services. And from law enforcement, you need to call us.
Yeah, it's so challenging, I think, for everyone, but particularly with our frontliners of seeing these new challenges every single day. You know, we're so appreciative of all the frontliners in the healthcare field and law enforcement as well. And with that, you kind of touched on this already, but I'd love to hear more about how you're all responding to reports of sexual assault specifically and what that looks like right now.
Sure, I'll start that off. Of course, we're still investigating sexual assaults. Like I said before, we're fully staffed. Our detectives are there. We're arresting people. We're doing investigations. We're doing arrest warrants. For sexual assault victims in the state of Connecticut, they have 5 days or 120 hours from the time that they're assaulted to go to the hospital, any hospital of their choice, to get a sexual assault collection kit done. This is free of charge. What they'll do is they'll do a kit. They'll process it for any evidence and they'll call us. The victim can remain anonymous if they so choose. They'll never see a police officer. We won't know their name. We won't know anything about them, but we will go to the hospital. We will collect that kit. The victim also has the option to have a police officer come and do an investigation. We can talk to them either remotely or in person, and they can speak to an advocate at the same time. And at the time, we'll still take that kit as well. In addition to the sexual assault kit, they can also do a toxicology kit in case you think maybe there was some kind of drug involved. That you only have a 48-hour window to get done. So you need to be at a hospital within 48 hours. Again, any hospital, anywhere in the state of Connecticut. We will go, we will collect them, and within 10 days by state law, we will have it at the state lab to get processed and checked for evidence. Now, the anonymous ones will be held. They won't be tested, but they'll be held for up to 5 years. So you have up to 5 years to decide whether or not to pursue it for that kit. And if you come about, then the minute you tell us, we will call the lab, it will get processed, and we'll begin to investigate. And detectives will be in touch with you.
Great, thank you for that. I think it's so important, such important information. A lot of people have misinformation. Lynn, did you want to add something to that?
Yes, I just wanted to say that when it comes to sexual assault reports and going to the hospital, one of the things that normally occurs before coronavirus is our local hospitals, which are Danbury Hospital and New Milford Hospital, would contact our agency. So for example, if a victim walked into one of the hospitals and identified as a victim of sexual assault, a sexual assault kit would be ordered and completed. And one of the things that the hospital does is they reach out to our agency immediately and contact our advocates in order to have an advocate come and respond to these calls. And we do that in person, 24 hours a day, 7 days a week. It doesn't matter what time. However, now that we are going through the current environment, that's looking a little different. So now if a victim walks into the hospital, both hospitals are still calling us, and we are able to assist the victim remotely. And it is happening and it is going smoothly. And I think we all have the same understanding that this is what's safest at the current moment. And we're still able to provide those services and support victims throughout the entire process, which can be really invasive and difficult, especially if you don't know what's happening to you. So we are doing that. And after the kit is completed, if the victim chooses to move forward with a criminal investigation, we also support the victim thereafter and work with them and get them services and assist them during the investigation, if you will.
Great. Thank you so much for adding that. Yeah, definitely everything is looking a little differently these days. So it's great to know what services are still accessible, even if they're remote. So our next question is directed to Attorney Hamilton. So it's my understanding that Connecticut Legal Services handles many divorce and custody cases for victims. So what is CLS able to offer in response to the coronavirus, and how, if at all, have those services changed, like we've kind of been mentioning, because of it?
Sure. Well, it does look very different. That's what we've been saying this morning, isn't it? That things look very different. But we're still at work. So with, as I said before, only 6 courthouses currently open out of 38, yes, we are very limited compared to what we used to be able to do. Previously, if a client called and was having trouble with getting child support paid or a visitation order honored, we know exactly what to do. And we do it all day long. And then file something for the client, go into court with them, advocate for them, go to the mediator with them, all of it. Well, we don't have those options entirely now. Right now, it's very difficult to file a divorce if you're in the Danbury area because our court isn't open. Having said that, every day it looks like we're taking steps to reopen Danbury, in particular Danbury and other courthouses as well. And I really do think that within the next 2 weeks, 3 weeks, we're going to see a huge shift on all of this, and things will open up again and we'll start to be able to file things. So for people who are feeling hopeless about, oh, there's nothing that we can do. Yeah, there's things we can do. For one thing, we can get the papers ready. We can get your documents ready so that when that courthouse door opens, we can be the first one in the door to get things started for you. So when it comes to things like modifications, divorces, custody matters, all we can do right now is provide advice, discuss the options, which is a conversation we'd have anyway, and then plan for when the court opens, plan what's going to be the strategy to deal with that legal problem. So that's what we can't really do, or at least we're hampered in doing. What we absolutely can still do is those priority 1 matters, which I touched on earlier. The restraining orders, which we went over in some detail, and also what's called ex parte custody orders. That is an emergency petition where one parent asks that the court grant them complete sole custody for particular emergency reasons. Those are still being heard in the court. So that is something we can continue to assist with, because that can be very important and can be essential to the safety of a child. So I think that's important to know. That's a priority 1, that's important. Just like criminal matters and the restraining order, that's one of the few things that are still getting scheduled. And for Danbury cases, that would be in the Waterbury court currently. Again, I expect that to change in the next couple of weeks. So those are 2 ways that, those are several ways that we can still help in this time. But sometimes I've found that clients who are referred to us and who we speak to, maybe not ready to file yet. They want to hear their options. They want to mull over their choices. There's a lot into that goes into that decision. There's a lot of ramifications besides the emotional piece of, whether they're ready to do it. So I feel like our job is to be here, ready, willing, and able to understand their situation and to translate that into legal techniques or legal things that we could do for them and present those options, because it's their decision, it's their life. And we're still here and able to do that. I mean, all of our attorneys are still working. Yes, our offices are physically closed, but we're all at home working and taking calls all day and emailing in any way we can find. I mean, I sometimes have conversations with clients. They're out in their garage in their car because that's the one place they can get a couple of minutes of privacy from homeschooled kids and whatnot. And sure, any way we can make it work. When the kids are taking a nap, sure, that's when we'll call you, or you can call us. And we just look for ways to be creative during this time. It's so important for people to understand we're all still working for you, and you're not alone with your problem. And this will pass. This will pass, and we can be helpful now and more so in the future, I think.
Yeah, thank you. We definitely resonate with the whole process of these are your options. We'll help you figure out what's best for you. We're never going to tell clients what they should do or need to do. It's all centered around what they feel and know is best for themselves. And we're just there to help them, right, offer that information. So we can definitely resonate with that of what you said. And I'd love to jump back to something you mentioned earlier, specifically talking about kind of vulnerable populations. You mentioned elderly and children. And I think it's so important that we highlight that there are specific populations that are impacted in very unique ways right now. And so maybe jumping back and opening us up to the rest of our speakers here and talking about how are those in particularly vulnerable populations, such as children or elderly individuals, those with disabilities, how are they impacted right now, and how are we supporting them?
I'll be happy just to jump in on one thing which I didn't mention, which is one of the things we help people with is immigration issues. And one population we haven't talked about are people who have immigration issues in this time period. They probably didn't get a stimulus package. They probably don't have their job because service industry is gutted by this virus. So the financial burden is unbelievable. They may be reluctant to ask for help because of their situation. And that's another area that I didn't mention before that leaps to mind about vulnerable populations right now. They have the same problems as people who are citizens of this country, the same, worries about their children and same worries about finances and keeping food on the table, and many, many less resources than a citizen would have. And that's also a big impact on our work, because sometimes they're in relationships in which their status is dependent on an abusive partner. So that's another way that we can be helpful. I just wanted to mention, because they shouldn't be forgotten right now either, as we all go through this.
Thank you.
Yeah, absolutely. I think about one particular vulnerable population all the time, which is children, although they're all greatly impacted during this time. With children, I think about the summer months when those of us who work in the social service field, we know that during the summer, things are a little quieter. So normally reports are made, and the case will go to the Department of Children and Family and Services. So someone will make a report of abuse, and the reports will come in and professionals will respond. However, in the summer months, that's a little quieter because children are at home and oftentimes are with the person that is abusing them. And so, we can't forget about the children who are in this community, because when they suffer from physical abuse and sexual abuse, it's usually from someone that they know, or a family member, or someone close to them in the home with them that has the opportunity to abuse them. And if they're home, they're not really or necessarily safe at home. And so I think about them a lot, and especially during us being impacted by coronavirus, and how we see these numbers dip a little in the summer, and then once school reopens in September, October, we start getting those reports. And it's because teachers, medical professionals, advocates, those that work closely with children are seeing bruises on them or seeing different signs that they know don't look right. And so when we do reopen, I want us all to think about taking a little extra time, because those vulnerable populations miss that, and just taking an extra look and asking a few more questions, because when children make disclosures, it's either accidental, right? So we see their bruises and we report it, or it's purposeful, then maybe they tell a friend because something's happened at home, and that friend tells an adult, and then the adult makes the report. And so just thinking about that when we reopen, and what part we're going to play as a community when serving and helping our vulnerable population.
Absolutely. Thank you.
Yeah, some of the other people that we're very concerned about, the elderly and people with cognitive issues. We've been getting a lot of check the well-being calls because they're not going to their regular group meetings, or for the elderly, they're not going and meeting with their regular home health aid staff because they're not going into the home. So we're doing a lot of more of these well-being checks and checking on them. And again, we're concerned about abuses that are happening to people that aren't getting reported. So if you're worried about a neighbor or someone along those lines and you think they should be checked on, then you should go ahead and give us a call, and we'll go knock on that door and make sure that they're okay.
Yeah.
Absolutely.
I just want to add one more thing. This is why prevention education is also so important. This is why we go out in the community and give presentations on the signs to look out for. And so that's another thing that the community can do in order to help our vulnerable populations, is just educate themselves a little bit more on these issues and the signs to look out for. And I also wanted, Attorney Hamilton, if you could mention a little bit about someone feeling comfortable working with Connecticut Legal Services, and if there's confidentiality or not, because I think that's important when we're working with clients.
It's absolutely important. And we have to try a little harder during these times, because normally what would happen is we would get a referral from the Women's Center. We'd set up a time to meet with the individual. And I usually do that at the Women's Center because they're already familiar with that space and they feel comfortable there. And sometimes their advocate will join the meeting initially or through it all for various reasons, just to make them more comfortable, right? And you develop a rapport and a relationship and trust. Now we don't have these options. We don't have this face-to-face opportunity just at the moment. So it's even more important that when I get on the phone with someone who can't see me, who doesn't know me, who never heard of me before, that I stress to them, everything you say to me is confidential. I will never even agree that I'm your attorney. I will never even tell anyone I'm your attorney. Like, this conversation didn't happen as far as anyone else is concerned. Obviously, if we file something for you and I go to court, it's obvious. But in terms of that conversation, it's so important just to reassure clients that what you say to me is confidential. But more important than it being confidential, because people have heard about that confidentiality, right, between attorneys and clients, it's more important that it's not only confidential, but it's non-judgmental. It's not that the attorney is not going to judge you, but that the attorney's not thinking about that. The attorney's there to help you wherever you are, and whatever your goal is. Getting out of a bad relationship, getting into counseling so that the relationship might improve, getting some custody orders so the threats that are being made to you about losing your children, can stop scaring you. Whatever that is, there's no judgment. There's no, it's not my goals. It's your goals. I want to know what your goals are, and I try to translate them into legal things. I try to translate them into actions in the legal sphere, and then support you through that until we get, the orders that you're seeking to the best of our ability, under the circumstances. And it's a little more challenging right now because we don't have these human ways of interacting, of sitting in a room together and just listening to people and letting them tell you what's going on. We don't have that. Now we have phones and email, and it's a little artificial in some respects, but it's temporary. We will get back together soon and have those kind of connections again, which I think are so important to developing trust between an attorney and clients, potential clients. But most important, I think the message I want to get across is information helps. It helps to know what your options are. You'll decide. No one else is going to decide for you. But you can't make a decision until you know what your options are. And that's what that conversation can give you. Options about what can I do about my situation, and is there a way out? And there is a way out. And between the Women's Center, myself, and Sergeant Cooney, there are ways out of your situation. And I encourage people to reach out for help, even if they feel like there's no options. We got options. We got ideas.
Yeah, and that connection is so important. And I think that's exactly why we're seeing, the virtual support groups are increased participants. People are craving that connection with others, particularly victims of domestic or sexual violence. That connection is so vital for healing, for recovery, for feeling not alone. And I think, as an educator, I couldn't agree more, Lynn, about the importance of getting information out there and providing trainings, providing knowledge to just help communities feel safer, right? With more information, exactly like you both were saying. And I think, particularly, obviously, I work with the college population, and I see them as vulnerable in the sense that right now they're at home with families that may not know anything about their history of domestic or dating or sexual violence. And it's really difficult, kind of like a couple of you mentioned before, to get that privacy. We're also concerned about a rise in online sexual harassment, and even with the LGBTQ community, of feeling like they already have a lack of resources, and now it's feeling even more of that disconnect or fear to connect with people to help them. And speaking of children as well as a vulnerable population, we're really concerned about a rise in human trafficking. We know that traffickers use online social media, digital platforms to connect with youth and to groom them. And now that youth are using social media and video games more now than ever, it's unfortunately created an opportunity for traffickers to utilize and take advantage of to connect with youth and to groom them for trafficking. So we're really concerned about that, and especially trying to get the word out to parents, the word out to kids on how to stay safe online now more than ever. So it's all of these populations are impacted in such unique ways, and it just again goes to show how complex domestic and sexual violence issues are. And I think we've already talked about this a little bit because it's hard not to mention, but I would love to spend a little bit of time, if we can, talking about how all of your offices work together, and especially now. So Sergeant Cooney, you want to start us off with that, of how kind of your offices all work together?
Sure. Well, you have a very good working relationship now with the Women's Center, as you can tell by this video. We've been working together for many years. We have programs that we've instituted, such as the Lethality Assessment Program, which we call the LAP. What the LAP is, it's 11 questions that an officer will ask upon a scene where there's domestic violence and it's between intimate partners. The reason why it's intimate partners is we found that to be the most lethal relationships. When you're dealing with homicides, it's usually an intimate partner based, or homicide suicide, it's intimate partners. So what we do is the officer on scene will ask those 11 questions to determine how lethal or dangerous that relationship is. If the victim checks in that it is a lethal relationship that they're having, then the officer will call an advocate at the Women's Center, right there on scene in front of the victim. Now, they're going to give the victim the option whether to talk to the advocate or not. They can always say no, or they can say, I will call the Women's Center at a later time, which is fine. But the point of that is to give them the access to do safety planning or get resources right then and there. This may be the very first time that they've ever even called for help. And we want to give them every resource we can to empower them to get out of that very lethal relationship. So that's just one of the many examples of how well we're working together.
Yeah, thank you.
Yeah, the lethality assessment program is so important, and it's been a really great tool to use when responding to domestic violence calls, and also with our working relationship in order to best serve the victims that we serve in the community. I think it has so many different pieces that are so important. The first being that it helps law enforcement identify which cases are high risk, and it educates them on their local domestic violence crisis agencies. So let's say they are working with someone on the scene, they'll make the call, and this is another area where we offer crisis response. So the police will call us, we'll get the call, and we will respond. So what that means is the victim has someone right then and there, and so does law enforcement. So, you know, if they are handling the case and they need to make sure that everyone's safe, you know, we'll respond and we will get the victim and shelter them, transport them, whatever they need, so that they can focus on the investigation and we can keep the victim safe. It also helps victims know about their resources where they may have never heard of the Women's Center. They may never have heard of a local domestic violence crisis agency. And so now it's connecting both the crime that occurred with their local agency and resources that they so desperately need. What happens after that is we are able to provide more resources like crisis counseling, support groups, legal advocacy, and connect victims with our court advocates, let's say. And let's say I have someone that I'm working with that was abused by their partner and now they're looking to get divorced. You know, we'll go over all their options and help them process, but it may be something where, again, we need to reach out to Connecticut Legal Services for that more in-depth conversation about divorce, custody, visitation, and, you know, support them on both ends. So, you know, the working relationship, educating all of us on the indicators of what a high-risk case looks like, all of that is essential in helping the clients that we serve. So,
Thank you.
So I have to say, one of the, you know, not to be Pollyanna here, but one of the silver linings of this situation that we find ourselves in is that, at least in the 2 years that I've been involved, and I know it was true even before my involvement with the Women's Center, we had forged such a collaborative, complementary relationship through many, many difficult situations that to help clients. And so when this happened, we already had like a structure in place and a relationship and this collaborative sort of feeling already in place, and we were able to pivot. And that might mean texting and emailing and calling and whatnot to try to do the best we could for clients who were in some problem, who were having problems, and to provide help as best we could. And that's all for the client's good, you know, that the client benefits from that. And we're just so lucky to have done the work of building that in the last several years, at least in my case, and people who came before me did as well, that we were able to manage as well as we have been during this time period. And it's been frustrating, and there's more we would like to be able to do, which we will soon be able to do. But our relationship with Women's Center has just been so valuable for clients. And it can be just a conversation about how we can pull together to assist the client and support the client, including, you know, sometimes even in court, sometimes I'll have an advocate from the Women's Center come and be with the client because I may have 3 or 4 cases on that day. And I just know that client needs to have someone sitting with them that day. Even though they're safe and there are marshals and whatnot, and nothing bad's going to happen in the courthouse, they just need the comfort of having someone who gets it and understands their situation sitting next to them. And sometimes I have to go into chambers and whatnot with other attorneys, and we just don't want them to feel alone. We want them to feel protected and supported. And that's what the Alliance has just done a really great job at. And we did it all through this period. We'll do it till we're back in court, and we'll do it when we are back in court. It's just been really, really positive and really helpful, I think, for the clients. At least that's what clients tell me, and I believe my clients. So thank goodness, that's all I can say. Thank goodness we had that basis to draw on during this unimaginable time. I mean, I've been practicing for 18 years. My courts have never been closed. I have been on 84 in a blizzard trying to get to court because the court was open that day. This is nothing I could have ever imagined that my courts would be closed. So the one good and bright spot I would say is that our working relationships were so strong that we were able to just keep working and keep helping people. And we still are.
Thank you so much. I think I can speak on behalf of the entire Women's Center to say we're so appreciative of all of the partnerships that we have in the community with both of your offices, obviously, and the hospitals and everyone that we work with. So we echo everything back to what you just said. And it just goes to show, right, victims deserve support in all facets of life. So however we can support them, however our offices can work with your offices to support them is going to be beneficial for them. So thank you all for answering those so thoughtfully. And now I would like to wrap us up and give you all some time for any final thoughts or an opportunity to share your contact information and any hotlines that you'd like to share at this time. So Attorney Hamilton, would you like to start us off with final thoughts and contact?
Sure. So not to be repetitive, but again, to encourage people who maybe, have listened to some of this, or that I want to let you know that Connecticut Legal Services attorneys and legal assistants and administrative people are all at work every day. We may be in kitchen tables and we may be in little offices and whatnot, but we are still at work and we are still fighting for you and fighting to help you, and do not hesitate to reach out. So let's talk about reaching out to legal services and the best way to do that. There's a couple of ways you can do that. If it's appropriate for you and you're comfortable doing it, I really recommend that you start with the Women's Center. Victims of domestic violence and sexual violence need lots of help. Legal is only one part of it. It's important, of course, but it's not the only part. It's of the whole situation. And the Women's Center can provide so many other kinds of support in a complementary way, totally, with legal services, that I really recommend you start there. The advocates are very well trained in knowing how to spot issues, particularly legal issues, and then refer the matter to us, and then we can run with it and we can go from there. So I would start there. But if that for some reason is not appropriate for you, or you're out of the area and you would prefer not to contact the Women's Center in your area, I recommend you call the referral line, and I'm going to give you that phone number, 800-453-3320, 800-453-3320. That's our referral line, our statewide referral line, and from there they will refer your matter, if appropriate, to the right attorney in your area. You can also go on a website, ctlawhelp.org. That's good if you just want to do some reading about various legal issues that you might be having. There's also information to be found there, resources and information that on legal questions. There's also www.slsct.org, another kind of clearinghouse of information and legal resources for you. But my most important message is you're not alone. There's help out here for you. We're waiting to hear from you. We're available to help. And if sometimes it's just a conversation that you want, you're not ready for action, that's fine too. You're not going to be pushed into action, particularly with, only 6 open courts. Not that easy to be pushed into action right now, but it may be helpful to have a conversation about options that might show you what the next right thing is for you and your family. So if that would be helpful, please reach out. Don't sit with your problems alone. We're here to help. That's what we do.
Thank you so much.
You're welcome.
I'd just like to say that if anyone is in any kind of abusive relationship or has been a victim of anything, please call 911. If you're in a spot where you can't talk, then you can always text 911 as well. When you're doing that, the most important thing, even if you only have a few seconds to talk or to text, is make sure you get out your address, a good address with a good apartment number or a floor number if you live in a multifamily. This way, the officers responding can find you in a very timely manner. Otherwise than that, we have regular phone lines at the Danbury Police Department. You can call 203-797-4611. That's 203-797-4611. Or you can go to our website, which is located on the city's main website, which is danbury-ct.gov. It has links to every city department, tons of information there. If you go to our police department website, it's got a whole list of different contact information there. It also has different brochures and safety tips for people in the public. Otherwise than that, again, if someone's in trouble, call 911 and we'll come out and help you.
Thank you.
So the Women's Center has two 24-hour domestic violence hotlines that I'm going to ask Cara to mention at the end of this. But one thing I think is important is if you're watching this and you're not from the greater Danbury area, to know that there are domestic violence and sexual assault crisis agencies throughout the state of Connecticut with advocates and counselors and individuals willing to help. And most of them are 24/7. So I'd like to give those numbers for those of you who are watching that want to connect with your local member agency and get to know what resources are near you. So if you're the victim of domestic violence, you're going to want to reach out to the Connecticut Coalition Against Domestic Violence. They have an information hub. It's called CT Safe Connect, and that number is 888-774-2900, and again, it's Connecticut Safe Connect, and they operate 24 hours a day, 7 days a week. If you are the victim of sexual assault or sexual violence, you can reach out to the Connecticut Alliance to End Sexual Violence, and they will connect you to your local sexual assault crisis agency, and that number is 888-999-5545, and again, that's 24 hours a day, 7 days a week. And I just want to thank everyone. I think the message is loud and clear. We are all here to help. You know, we're doing the best that we can, but we have built very powerful relationships so that we can provide you with the best services, because we know there's a need, and we know that these issues are truly important. So thank you all.
Absolutely. Thank you. So to add to that and kind of wrap up with our Women's Center contact information, as Lynn mentioned, we do have two 24/7 hotlines available since we are a dual agency for both domestic and sexual violence. So you can reach either of those 24/7 hotlines at 203-731-5204 or 5206. So again, that's 203-731-5204 or 5206. Those are our two 24/7 hotlines. And then you can also reach us on our general line, which is 203-731-5200. So you can connect to ask questions, to follow up about anything, to connect with a counselor. Maybe it's not a crisis, but you'd like to schedule an appointment. So that line is available as well. And then you can also reach us by email at womencenter@WCOGD.org. Or if you're interested in learning more about our services or how you can help, you can visit our website at www.wcogd.org. So I would like to echo the thank yous that have been going around. Thank you all for those of you who are watching right now to learn about the services that all of these wonderful people in their offices provide. And thank you obviously to our speakers. So I want to thank Sergeant David Cooney for being here today, Attorney Patrice Hamilton for being here, and our very own Lynn Nichols. Thank you for taking the time out of very busy and stressful days to speak to the public about these very important issues. So we appreciate you being here. And if anyone has any questions, please don't hesitate to reach out. And that is all we have today. So thank you all.
Yeah.